Hi there, I'm Dr. Mark Erickson, and I'm a physical therapist. Thank you so much for clicking on this presentation. I really appreciate your time, and I think you'll find that it's well worth it. It's a brief 10-slide presentation, and the intention is to introduce you to new resistance technology, air resistance technology called Wingx. It's very innovative, new, and I've been using it now 6 months or so. I was introduced to it a bit ago and using it both personally and with my patients. And I think it's just great. I'll get into that in a little bit. First, a little bit about my background. I've been practicing 42 years, so I'm really old, and this is one of the best products I've ever seen come out. I think it has a lot of tremendous applications in physical therapy and rehab. So I started my career in general acute care, like a lot of us did back then, and moved into outpatient orthopedics. I've worked in athletic training environments, worked in nursing homes, athletic training environments, and I've had a private practice now for the past 33 years or so, 35 years. Um, and that's Insight Physical Therapy. Let's see, I've also taught in orthopedic residencies, taught many post-professional continuing education courses, as well as teaching in academic environments in both physical therapy and exercise science. Let's see, in addition to my work background, I've been a certified Feldenkrais practitioner now since 91 or so about 30 some years, 34 years. And the Feldenkrais method is a method of focusing it primarily on body awareness. It uses two strategies: awareness through movement and hands-on functional integration. So if you ever happen to be interested in the Feldenkrais method, learning more about that, please feel free to reach out. It's I think tremendous. It complements physical therapy so well in terms of how we get our patients to be aware of their bodies so that they can better do what they want to do and have a better quality of life. Also certified orthopedic manual therapist, OCS, and certified strength and conditioning specialist. So I have a little bit of a broad background. Um, like I said, I learned about the Wingx about 6 months ago or so, and they're incredibly versatile, incredibly functional. I think it's by far the best resistance training device I know of that resists an entire functional pattern, and not just resists it, but resists it really well throughout the entire range of motion. We'll talk about the mechanics of that in a bit. Um, but if you take and do a golf swing, tennis swing, um, any type of functional activity that involves the whole body, you can resist it with the Wingx. And the reason I think one of the key reasons for that is that the moment arm of the Wingx never changes. So it's always producing good resistance throughout the entire length of the muscle or the entire range of motion of the joint, whichever way you want to look at it. So numerous benefits, just like every resistance training device has. We all know the multiple benefits of resistance training, but the key, I think, with the Wingx is how they provide the resistance. And that's what I'll go through in the PowerPoint. And like I said, I think they're just tremendous applications in physical therapy. So I'm looking forward to sharing those with you. So let me go to the PowerPoint and we'll get started. Here are the Wingx of the air resistance technology. It's a patented concept. And you can see they're definitely a non-traditional look, but most things that are new and innovative are non-traditional. Let me click here. Okay, so key benefits: accommodating resistance, functional, like I've been talking about, bidirectional resistance. So you resist both the agonist and antagonist in the same repetition. So you can look at it a couple ways. You can cut your exercise time in half, or you can get twice as much done in the amount of time one devotes to resistance training. Bidirectional, and then also very versatile. So you can focus with unilateral, one joint, one plane. You don't have to do bidirectional resistance. It can be unilateral. You can start with early rehab with very little resistance because it's accommodating. So if a patient pushes against it easily and doesn't create much effort, they don't get much resistance, and then they create more effort, they get a lot of resistance. It's a bit like, not a bit, it's very similar to doing resistance training in the water, except a couple of great big benefits. One, you don't need a pool, don't need to change into a swimming suit, and you can still, with the Wingx, you can get resistance overhead, which is obviously quite difficult in the water. And then they're biomechanically superior for the reason I already mentioned, right? I believe anyway, it to be the reason I already mentioned, that the moment arm never changes. So you get this very, very smooth resistance throughout the entire range. Okay, so safety first, accommodating resistance. It's a bit like isokinetics, for those of you who are familiar with isokinetics, where you push against it as far as hard as it pushes against you. One of the biggest benefits over an isokinetic machine is that an isokinetic machine has a fixed axis, whereas the wings are, movable throughout all dimensions and all degrees of freedom. Um, like I said, the resistance matches the patient's force, which was really torque. Again, not to bring back PTSD from biomechanics class or anything like that, but we all know that every human functional movement at any joint, spine, etc., are sums of torques. And so the resistance matches the patient's ultimately their torque, which is an indirect measure of force. So this helps decrease injury for obvious reasons and helps increase patients' confidence. What I've seen in my patients is they start with it, they're a little unsure, similar to how most patients are unsure right after surgery or an injury or a new diagnosis. They've maybe not been to physical therapy before. They haven't exercised much before, so they're a little apprehensive, kinesiophobic, if you will. And when they start using these, it's very natural. So they get the hang of it, and then off they go. And what's really been kind of fun to watch is how the patients will actually create their own exercises that are unique to, one, their creativity and their personality, but also their functional demands. So all the way around, I think I've just found that they've been well received by patients. And again, I think one of the main benefits of that is the increased adherence to their home program, which usually means they get better faster. So very functional, like I said, so you can resist an entire movement pattern um, in any plane, either uniplanar, biplanar, triplanar. Um, you can focus with them unilaterally or bilaterally. And again, like I said before, unidirectional or bidirectional. Okay, they offer both. So they mimic a lot of different sports very, very well. Cross-country skiing is skiing, not downhill skiing so much. Maybe ski jumping, get a little more distance. But with downhill skiing, they work really well. And I'm from Wisconsin originally, not downhill skiing, I'm sorry, cross-country skiing. They work very, very well to mimic the functional demands of that activity. Okay, so I'm from Wisconsin, which is hence my affinity for cross-country skiing. So bidirectional resistance, much more efficient. Like I said, cut your exercise time in half, which I personally enjoy because I just have really never fallen in love with resistance training. I tried many times, a lot of New Year's resolutions, and just never panned out. And once I came across these wings, they're just so much more fun, and it's fun to make things up, different patterns, and it only takes 15 minutes or so to get a really good workout. Um, or like I said before, you can double your total work if you work for the same amount of time and you're working two muscle groups simultaneously, or at least in the same repetition. You get twice as much work in for a given amount of time. And again, this all improves compliance or adherence, greater cognitive challenge. What I do with a lot of patients is various movement patterns. Like I'll use a Z for example, a Z pattern, and they'll trace a Z, which is easy for most people because they're used to writing a Z. Then they have to do a backwards Z, and that gets more challenging. And if you start playing with the alphabet, an N or an M or a W, and then backwards, the patients end up having to concentrate a lot more than they do with regular dumbbells or bands or cables. Um, the concentric motion, the concentric mode of operation rather, mimics a lot of functional activities that require power. So say, for example, your patient needs to change directions. And, whether it's just a quick turn to avoid something or an athletic endeavor where they slow down, eccentrically cut and go the other way quickly, the powerful contraction is always concentric. So the wings train people for power as well as muscle endurance, as well as muscle strength. Okay. So versatility, isolated integrated strengthening. What I mean by that is, say, for example, you're working with somebody after a rotator cuff repair, and I'll just use my right arm and say we're working on internal rotation. Okay. So internal rotation. And they start out with isolated GH internal rotation, slow and easy, say it's early in rehab, and then they kind of get used to that. Then we start putting it together with arm trunk, okay? Arm and trunk, getting the timing and sequencing and recruitment for motor control. And then once they acclimate to that, then we add lower extremities so they can start using ground reaction force in simulating an aggressive tennis swing, pickleball swing, um, any type of device, baseball, golf. So the versatility is in the flexibility the device has to cover early rehab to late rehab, upper extremities, lower extremities, trunk, cardio, as well as muscle, as well as cognitive, and motor learning and motor control. The other thing I've learned about motor control using the devices is they slow the function down adequately so you have time to actually focus and make a change or analyze, become aware of what you're doing at various points during the range of motion. So say, for example, the golf swing, and you finish your backswing and you start your downswing and you want to push from the ground. So you have a patient concentrate on the ground reaction force component, and then the core component, and then the upper extremity component, maybe one at a time, and then two out of the three, and then all three of the three. So they, as they are progressing through rehab, they become much more aware of the interconnectedness throughout the functional pattern. And the role that the Wingx plays is to slow down the pattern enough and still maintain the same recruitment sequence and the same kinematic motions as they would do during the actual pattern, just at a slower velocity, so that they have time to analyze and then make alterations in their motor behavior. So the Wingx are adjustable, which is nice. If you move the handles more toward the middle of the device, what would happen is that the moment arm for the device is reduced, therefore the amount of torque it produces is reduced, which makes it easier on the patient. Okay, so overall, I think you get the sense that between the accommodating resistance, the versatility, the covering all different areas of the body, cardiac system, nervous system, motor learning, motor control, that the Wingx, they just give you more bang for your buck. Biomechanical superiority, I've already talked about the moment arm, and I think what creates the smooth resistance is the fact that with the Wingx, just like in water, the moment arm of the resistance never changes. So the resistance is very, very smooth. It's a lot more fun. Again, aiding toward or enhancing, facilitating adherence and compliance to the home program. It gives us a chance to strengthen the patient's muscle throughout that joint's full range of motion, or throughout the full range of motion of the function, the full trajectory. Another way to say that, of course, is through the full length of the muscle. So more work gets done per repetition. So theoretically, the patient would get stronger quicker, and definitely there'd be more calories burned per repetition because they're working out, getting more work done through a greater range of motion. So the resistance, like I said, is very, very smooth, and I think that's one of my favorite aspects of the Wingx, at least. Okay. So also they're very practical, very easy to use. Just strap on to your forearm. There's a brace that goes around your forearm, and then you have the handle, and then you move. And they're very portable. They fit into a small backpack. They come in a bag, and they fit in that bag fits into a small backpack. A lot more fun. It's been a lot of fun watching patients, create their own. They create their own exercises that I may have said this already, that match their personality, but remember, old brain. So they're great in clinic. They're great for home programs. Several of my patients have purchased a pair, and they just love them. And overall, on top of all those benefits, incredibly safe because of the accommodating resistance. So if you have any inquiries, please give me a buzz. What I'll do is we'll move into some videos now to show various movement patterns and different exercises that I found to be especially useful with the Wingx. So thank you very much for your time, and we'll go ahead with the videos.